歡迎大家出席。 the intensive care unit. frequently after class resumption. How frequent does it have to be? Is it a daily test or what? Another question, the indicator as to when classes have to be suspended again. Under what circumstances will you have a full suspension or partial suspension? Thank you for your questions. The mass RT testing exercise, as we mentioned, for April 8th and 9th, those who took tests on those 2 days, we picked up 2,202 RAT positive cases. These are cases successfully declared, and we expect the number to go up. For now, it's hard to tell how many exactly we will find in the end. Most cases are found on day 1, and on the second day, the cases dropped. People have been following our advice, that is, by taking RT tests from April 8th. Most cases were picked up on April 8th. And for those who tested positive on day 1, they wouldn't do it again on day 2, so there was a drop in day 2. We have to wait till the whole exercise ends, and then we will see how many cases we identify. At this point, we can see it's effective. We now have more than 2,000 RT positive cases picked up. 70% or close to 70% are asymptomatic carriers. Had these people not done the RT test, they wouldn't know they have been infected. They would have been out and about and come into contact with other people, and the transmission would have gone on, leading to more cases in the community. We have picked up more than 2,000 cases now, so that means it's effective. Compare that with what we pick up through PCR tests. We're now picking up more cases. The ratio of PCR versus RT cases, the ratio was 1.1, but yes, as of yesterday, we now have the ratio at 1.8 to 1. There's also, but the problem is we don't have the denominator now because we don't know how many people are taking part in the RT exercise. So we hope more people can take part in this exercise so that we can cover more cases. The other question about compulsory universal testing. If we go ahead with this, we have to review the situation after the 3-day RT exercise wraps up. We also have to consider our capacity for PCR tests and the impact on people. Finally, class resumption. I believe the Education Bureau will announce the detailed plans about class resumption. The key thing is key risk management to minimize the risk of outbreaks at schools. Testing helps. This is an effective way to help prevent cases from finding their ways into schools. If students test positive, they should stay home, and schools should also report the cases to us. And we will advise the schools on the measures they should take. We'll take the next question, English question.
From SCMP News. A few English questions. Yesterday it was mentioned that for the RAT testing scheme, there are issues of people reporting their negative tests on the RAT platform. I'm wondering if the situation for that has improved recently, or has the communication between the public to carry out the testing drive in general improved today, or can more be done to enhance the communication? And second question, just now earlier it was announced there was a 2-week ban for Turkish Airlines, but before that the airline had to make their own announcement that they received the CHP ban. So why was the Turkish Airlines ban not announced by CHP last night? And why is there some inconsistency in terms of announcing some of the flight bans? Is it fair for Hong Kong residents if you don't tell them in advance of a flight ban? Thank you.
Two questions. For the first question on reporting of RAT positive results to our platform. Yesterday we noticed that some citizens they have performed the RAT test and was tested negative, But however, they have misunderstanding that they need to report their negative results to the platform. So they have go to our platform and report the results to us. There are a few of these citizens, and they have uploaded their negative photos. So yesterday we have reminded people that they only need to report to the platform if they were tested positive, because after the reporting, we will they need to complete a questionnaire on the risk assessment. They need to submit their personal and also health information to us, and also the information on their home environment, so that we can make assessment on the suitable sites of isolations for these people, and also issue isolation order for them, and also quarantine order for their household contacts. So this platform is not for reporting of negative results. Yesterday we have we made some enhancement in our website, and so starting from yesterday evening, people, when they go up to our website, they need to there will be a pop-up box reminding them, and also they need to verify that they are tested positive with 2 lines on the RAT quiz before they start to report. And also, we also have another random survey or random sample, and we will select a certain number of RAT positive cases and arrange them to have RAT PCR test to verify their results. For the flight suspension for TK083, on arrival on the 8th of April, there are 3 cases on this flight. So yesterday evening, the Food and Health Bureau has suspended Turkish Airlines from Istanbul to Hong Kong for 7 days, starting from today, 10th of April. And we will announce it in our press release today. Yes, because it is decided in the evening. Because we need to do some investigation on the cases to see whether they are recent cases or repositive cases. So this takes time.
下一題，呢邊呢位先生。
Next, the gentleman over there, please. I'm from AM730. About the mass RAT testing exercise, you mentioned 2,202 cases. How many isolation and quarantine orders have you issued? And have these people been vaccinated? And do you have further breakdown about how many cases of the cases with symptoms? How many are silent carriers? And how many have reported positive cases wrongly? How did you find out about these? Now, close contacts are mainly household close contacts. Now, what about when schools resume? Would you track close contacts in school when there are cases? Or would you just follow up on household close contact cases? You've asked 3 questions. First question is about isolation order for positive results declared online, and if people have uploaded their photo and Hong Kong ID card, then there will be an automatic issuance of isolation order. The place of isolation will be based on our risk assessment, because when they declare the case, they have to fill in a questionnaire, and then we will look at the information provided, and we'll do triaging. Which is in line with the current triaging management policy. So, for example, we see whether the cases have symptoms and whether these are high-risk cases. People are able to take care of themselves. Are they able to monitor their own health condition? We also look at the household condition. And then when they declare the case, of course, they have to provide information about their family members, and then we'll issue SMS to family members. And when family members receive SMS, they have to input their ID card number and their phone number so they could get isolation, quarantine order. As for some who mistakenly think that they need to declare negative cases, there are a handful of those cases. It's happened before on the platform, and we would do random checks, and so that is among the successfully declared cases, we will randomly pick some cases, and it was ask our contractor to go to their homes for nasopharyngeal swabs so we could do PCR tests. And we have found that less than 5% of the cases are actually negative. And for these negative cases, we'll do investigation to see why the PCR test is negative. Is there fraud involved, or is it a case of positive case or false positive case? So for these cases, of course, we will cancel the isolation orders, and we will also remove the case. As for tracking of close contacts after classes resume, now we focus on quarantine for household close contacts. For students, if they become close contacts, of course, they can't go to school. And if there are positive cases in school, we will conduct investigation, we will take public health measures. But then this time round, things are different than that for the fourth wave, because the fifth wave, there's not available RAT. So students could take RAT before they go to school. Then the risk of cases going into a school would be minimized. Of course, we'll update our prevention and control guidelines for schools. For example, when students take meals, what sort of precautionary measures are necessary, and then so we could minimize the risk of infection among students. Sorry, the speaker's not using microphone. I don't have the actual figures at hand. I think we are talking about 2,000 or so cases. Mostly these are family members. Next question. I'm from Ming Pao. Good afternoon. I want to ask about the RAT. Now there are 2,000 or so cases, asymptomatic cases. 2,000 plus cases over 2 days. And then you mentioned figures for asymptomatic and symptomatic cases. And then there are also cases that tested positive with RAT, but then they are reported via other channels. Why? Because they have done so after the 24-hour period or what? And then if you receive declaration of these cases, does it show that there are, say, elderly who've had difficulties declaring their cases or what? And my other question, you gave us the analysis of serious cases involving children. So what is the percentage of serious cases involving children? Now you assess how serious the situation is. What sort of symptoms or problems there are with the serious cases, do you know? And then you say you're going to update the prevention and control guidelines for schools to minimize risk of infection. When would you update the guidelines, or have you already done so online? For the 62-year-old case mentioned, Dr. Lau, do you have the patient's vaccination record? And for this 62-year-old and the 31-year-old cases, did they die with or die of COVID?
或者我答咗。
I'll take the questions first, and I'll invite Dr. Lau to tell us more details about the cases. For the 2,202 cases, 68.7% are asymptomatic patients. This number is higher than the cases we found before April 8th. For those cases, asymptomatic cases made up roughly 35%. Over the past 2 days, there has been an increase in asymptomatic patients who did an RAT test and submitted their positive results. In terms of the absolute number, there has been a noticeable increase in RAT positive cases. As PCR cases drop, RAT positive cases have increased. For a small number of cases submitted by other channels, elderly care homes did RAT tests for their residents, We include these reported cases into our total tally, but these cases were not submitted on our online platform. Starting from yesterday, some people call the Home Affairs Department hotline as they may have struggled with our online platform. The HAD referred those cases to us. As these cases may have struggled with the internet, we provide assistance. There are also cases who used RAT at designated hotels. But the question about critical cases among children, we had this preliminary analysis. Among child COVID patients, some serious cases were admitted to HA hospitals. We looked at the information from the hospital authority. Some clinicians have determined that some of the cases were serious cases. Some even required treatment at the intensive care unit as they were in critical condition. For cases determined as serious or critical, we tallied the number of such cases. As of April 3rd, we have 48 such cases. We use the vaccination status as the denominator, vaccinated or the number of jabs. And then we look at the number of, for those unvaccinated, 8 out of 10,000 were in critical or serious condition. And as the more jabs they had, the fewer people or fewer children were in critical or serious condition. That means vaccination helps reduce the risk of serious infection. But this does not include details as to why they were admitted to the ICU, etc. As for the prevention guidelines for schools, guidelines regarding ventilation systems, etc. have been uploaded to our platform. As for the other guidelines, the CHP has issued the prevention and guidelines to schools. The guidelines will be updated again before class resumption, but some details are still being discussed with the Education Bureau. Later on, the EDB will announce the details about the class resumption. As for the 62-year-old patient, the resident at the elderly care home, in July last year, this person had the second dose of Comirnaty. On March 13th, the patient was hospitalized and then was transferred to the Buddhist hospital. We administered remdesivir and antivirals. The patient was recovering. The transfer to the Buddhist hospital was due to the malignant tumor, which spread to other parts of his body. At the Buddhist hospital, he received palliative care. He passed away yesterday. We don't know if the experts have determined whether he died of or with COVID. But the preliminary signs show that this patient recovered from COVID. But the death may have to do with his existing condition, the tumor. As for the other male in his 30s, he died rather rapidly. His heartbeat and breathing stopped at home. So he has been taken to a public mortuary. The cause of death will not be known until the coroner's court looks into the case. We don't know if his death has to do with COVID yet, but the RAT test at the A&E department came back negative. Next question. The lady over there. I'm from Hong Kong 01. There are now more cases of asymptomatic patients. Relaxing the social distancing restrictions now, is that a sign that we're living with the COVID now? Are we testing the waters now with class resumption? Does it mean that in the future people will all have to do RAT tests before going out? Not every family can afford buying RAT kits. are the authorities discussing whether to hand out test kits to households? We just mentioned 5 cases picked up at designated hotels. Do we have cases picked up, that is, cases who returned to Hong Kong after April 1st and then tested positive after going into the community? Thank you for your questions. For those asymptomatic RT positive cases, these are silent carriers. These people have no symptoms. They wouldn't have known they were infected were it not for the RT test. They have been there with or without the RT exercise. Before the 3-day RT exercise, there were roughly 2,000 new infections reported every day. We have always had these silent carriers. But through the 3-day RT testing exercise, we have uncovered carriers that would otherwise have remained silent. This exercise helps us identify such cases, because without identifying the cases, these cases may have spread the virus to other people, as people would have get tested only after they have developed symptoms, or at some point the virus gets spread to seniors. And then upon hospital admission, we find out that the cases probably came from some silent carriers. It's a good sign that we are uncovering silent cases, and it's also a positive sign that we are picking up more cases. After the cases are identified, they're isolated so that they do not spread the virus further in the community. For the social distancing measures, as the Chief Executive mentioned, in the coming week, the government will announce more details as long as there is no rebounding cases and remain at a stable level, or there's a steady downward trend in infections. Some measures may be relaxed. For the RT exercise, people are now more familiar with the RT test. With such a kit, it takes just a few minutes to do the test, and then the result comes out in less than half an hour, and people can do the test at home. This is both an effective and convenient way for people to know if they have been infected. And previously, they would have to go to a testing center and have to wait before they can know the result. We encourage people to do regular tests with RT kits to find out whether they have been infected, so that if they are infected, we can identify them quickly. For RT arrangements after class resumption, I believe the Education Bureau will announce the details later on. The government has enough RT kits. When necessary, the RT kits can be provided to those who need them. For those who have completed their quarantine at designated hotels, now we haven't found any cases where people test positive after finishing the quarantine. Now, after the place-specific flight suspension mechanism is relaxed, we also have a new arrangement for the quarantine period has been shortened to for people who have completed the 7-day isolation at the hotel, quarantine at the hotel. On day 12, they have to do a PCR test at the community testing center. The first batch of arrivals may be doing the PCR test in these 2 days, but I haven't heard about any infections so far.
I'm from Hong Kong Economic Times. For RAT, there are 2,200 plus cases. And then from the mass voluntary RAT testing cases, there are 2,202 cases. So how did you arrive at this figure after discounting cases from quarantine hotels and so on? So without the mass RAT, so you're saying then you won't be able to come up with this number of 2,200, is that right? For the 31-year-old deceased, male. Now he had myopericarditis. Has he recovered from that? So has it to do with that case? Because it seems that he had the disease quite some time ago, and then you don't know he's been infected. So are there any close contacts, say, among nurses or other patients? And for the death case, there's one death case who the person's received 3 jabs. So do you have more details? And then for the 48 child cases, do they have any problems? There's 38 serious cases. So are there any cases of children who've had 2 jabs and who were critical or serious after being infected? I'll take the first 2 questions, and perhaps Dr. Lau could answer the third one. The 2,202 cases. These are all successfully declared cases, meaning the patients concerned have all received the isolation order. And yesterday, there's just a handful of cases that did not come through the declaration platform. I mentioned 1,033 RAT positive cases for yesterday. Of that, 969 cases were declared via the platform. For the remaining 66 cases, they were declared through other channels, for example, from residential care homes. Now, we wouldn't say that if we didn't have the mass voluntary RT testing, then we wouldn't find these 2,000 plus cases, because some of these cases say symptomatic. So without the mass testing exercise, people may still do the RAT when they have symptoms, and then we will record cases. But then for what we see is that there is a high percentage of asymptomatic cases. So that's reversed the ratio. If we look at the PCR, and then if you do use a PCR test positive cases to do projection, then for yesterday, there should be just about 800 or so RAT positive cases based on the PCR positive cases. But then yesterday there were some 1,600 RAT positive cases. That shows that there are more people doing RAT, and so more cases are found, especially among those with no symptoms. As for serious cases, well, as I said, it's just an initial analysis. We have not looked at the actual clinical assessment of each of these cases. We will get more information from the hospital authority so we could do a more detailed analysis. But then the figures themselves are self-explanatory. Among those not vaccinated, there will be 8 serious cases out of 10 per 10,000. For those who had 1 jab, is 2 cases per 10,000. And then for those who've had 2 jabs or more, then it's just 1 case per 10,000. That shows, therefore, for among children, vaccination is also very effective to prevent serious cases. For the 31-year-old deceased patient, between the 17th and the 20th, he stayed in a public hospital. As I said, when he was admitted, there were irregularities in his ECT. We also did ultrasound on his heart, so that's why we suspected he had myopericarditis. We gave him medication, and then there was good progress. His symptoms improved while he was in hospital. And then when he was discharged, he was referred to do an examination, and he was asked to come back for follow-up consultation. But from our record, we don't see any follow-up consultation for him. Now, what happened was he fainted at home, and then by the time he arrived at hospital, he had no heartbeat and no breathing. As for the actual cause of death, I think we have to wait till the coroner has done the autopsy and investigation before we can be sure about the cause of death. For the patient who's had 3 doses of vaccine, so he had 2 doses of CoronaVac and 1 dose of the BioNTech vaccine. Now that patient had some underlying condition, hypertension, and lymphatic disease. and that disease would lead to a low red blood count, white blood count, and of course white blood count is important for preventing infection. So because of the disease, he had low blood count, and maybe for that reason, even if he had 3 doses of vaccine, he could be prone to complications. Now we have administered different antiviral drugs to him, including remdesivir, but unfortunately, the patient passed away yesterday. Thank you. That's the end of the press briefing. Thank you.